For our film project, we did He Loves Me, He Loves Me Not. Our main character is Angelique. Angelique is a gifted art student in her early 20s. She falls in love and builds an obsession with Dr. Lloyd LeGarrec, who lives next door to the house she is house sitting at for the summer. This affection is sparked after he gives her a rose from a bouquet he bought for his pregnant wife. Angelique then became very persistent on the belief that Dr. LeGarrec will leave his wife for her and reciprocate her romantic affections. Angelique becomes obsessed with Dr. LeGarrec to the point where he is all that she thinks about. She lives by herself as her father is deceased, and there is no mentioning of any other family. In the film, she only has 2 close friends, one of which happens to be in love with her. The film takes place in the early 2000s in France. Angelique temporarily moves in next door to Dr. LeGarrec after deciding to house sit for the owners, who lived in a wealthy neighborhood. At that time, the signs and symptoms of her disorder were not obvious and only began to present themselves after Dr. LeGarrec gave her the rose. Specific knowledge about some disorders like schizophrenia and delusional disorders also wasn't as developed at the time. The disorder we diagnose Angelique with is the erotomanic delusional disorder, which is under the schizophrenia spectrum. The erotomanic disorder is one in which a person has the delusion that another person is in love with them when they actually aren't. Erotomanic delusional disorder is diagnosed in all cultures, as all it needs is delusional thoughts for a month or longer and an environment that fosters the development of them. In this case, Angelique had these thoughts for months and was presented an environment with the doctor that allowed her to overthink the simple, kind gestures from him for romantic interest. Symptoms shown: the presence of 1 or more delusions with a duration of 1 month or longer. Angelique became obsessed with the doctor after he presented her with the rose from the bouquet that he bought his pregnant wife out of happiness. This led Angelique to believe that the doctor had some sort of romantic interest in her, which led to her delusion and love for Dr. LeGarrec to grow for several months after. Thought disorder: when a person has ways of thinking that are unusual or illogical. Angelique overthought every little thing Dr. LeGarrec did, including driving her home after a business event that she decided to show up to in order to interact with him. She mistook this for him having a romantic interest in her, once again, despite the fact that she was simply staying next door to his house and he was being a gentleman by not letting her walk home alone. Symptoms that aren't presented: major or manic depressive episodes. Angelique doesn't have any major or manic depressive episodes due to her delusions. She does have a bit of a psychotic break in the middle of the movie, where she destroys all of her shrines of the doctor out of rage, which could be perceived as a depressive episode. This is actually where her obsession grows the most, however, and Angelique stays fully functioning during this time. She doesn't show the stereotypical signs of a depressive episode, and actually continues to pursue her delusions even more despite this fit of rage, rather than incapacitated by Dr. LeGarrec's rejection.
Treatment. Our proposed treatment for Angelique is putting her on antipsychotic medication and coordinated specialty care and providing education and support for her friends. We believe that this treatment is appropriate because it will cover the treatment of all of Angelique's symptoms and it will educate her friends on disorders similar to hers and how to recognize and treat them. One ethical concern we have would be the quality of treatment within the facility that Angelique would be placed, as not all facilities have ethical practices in treating and housing their patients. This would present a concern to make sure that she is placed in an ethical facility with proper care for her disorder. One possible barrier in treatment for Angelique could be that she doesn't have any living family members to help pay for or organize her care. Not having any living family members also means that the doctors wouldn't have anyone to provide immediate family history for treatment or anyone related to her to contact in case of emergencies. Another barrier with no family members could also be that there is no one that's legally allowed to sign for Angelique in the case that she is proven to be mentally incapable. Broader perspectives. We found that the film portrayed Angelique's erotomanic disorder accurately. In this case, the symptoms were clearly displayed for the audience. The movie begins with Angelique's perspective, but once the perspective of both parties involved are revealed, it is clear that Angelique has a delusional disorder that needs to be dealt with. How does the film influence our own understanding? Most films tend to over-exaggerate or be unrealistic when portraying symptoms, when in reality it might not be that easy to catch on to certain disorders. Films also add details or fake symptoms that one might attribute to a real disorder. Overall, films can typically provide misleading information that often portrays disorders to be obvious. This can lead people to overlook or misattribute what the actual symptoms of the disorder are. And these are our sources used.